And action. 1 in 6 Asian Americans have type 2 diabetes, and half of those affected do not even know they have it. This video will explore the reasons behind the revised screening guidelines for diabetes in the Asian American population. Let us begin by looking at two people from different ethnic backgrounds. An African American woman with a height of 5'3", about 1.6 meters, and 145 pounds, about 66 kilograms. If we calculate her BMI, it would be BMI of 25. BMI stands for Body Mass Index, and the BMI is used as an approximate measure of whether someone is over or underweight. 25 is just borderline overweight. The second woman is an Asian American Filipino with a height same of 5'3", about 1.6 meters, and 130 pounds, which is about 59 kilograms. She has a BMI of 23. Which person do you think is at a higher risk of diabetes? If you said the Filipino Asian American woman, you are correct, and this video will explain why, despite her slimmer appearance and lower BMI, she is at a higher risk. Now, diabetes is a chronic illness where there are high amounts of sugar, also known as glucose, in the blood. The risk factors for developing diabetes include a sedentary lifestyle, obesity, gestational diabetes, hypertension, high cholesterol, vascular disease, and family history of diabetes. In the long term, as a result of persistent high blood glucose in the blood, diabetes can cause many deadly and disabling complications, including eye disease, cardiovascular disease, kidney disease, and diabetic foot. These complications in turn can lead to blindness, heart attack or stroke, end-stage kidney disease, and amputation of limbs. Therefore, screening for and treating this chronic disease is paramount. Current American Diabetes Association guidelines for the generalized population is if someone has a BMI equal to or greater than 25, plus having at least one of the risk factors mentioned previously. BMI is one way of measuring whether someone is overweight. However, it has its flaws. Someone can be super muscly and have a high BMI, and some ethnic groups, as we have seen, can have a low BMI but still have a high risk of diabetes. Although flawed, it is still valuable in giving the clinician a snapshot in short clinical visits. A landmark study in California conducted by Carter and colleagues looked at the prevalence of diabetes in different ethnic groups. They showed soaring prevalence of diabetes amongst Pacific Islanders, about 18%, Filipinos about 16%, and South Asians about 16%, when compared to racial and ethnic groups traditionally attributed with diabetic risk factors, such as Latinos 14%, African Americans 14%, and Native Americans about 13%. As you can see, the Asian population has a relatively high prevalence of diabetes. However, the measured BMI was consistently lower. Simply put, Filipinos and specific groups of Asian Americans had higher rates of diabetes, even though they were not obese, according to the BMI. This 2013 study showed the concern that non-obese Asians have high rates of diabetes and might be undiagnosed. This is where the study of fat distribution comes in. Prior American Diabetes Association guidelines were generalized and did not take in ethnic variability and fat distribution. If we take a cross-section of the tummy, it shows the relative difference in size straight away. This African American woman may have a lot of peripheral fat, which is the fat that can easily be seen under the skin. But she has low central fat, fat which surrounds the organs, which is not visible by the naked eye, as depicted in yellow here. Whereas the Asian American woman may have less peripheral fat, but much higher central fat concentrations, up to 3 times the amount. This means that a falsely deflated Asian American BMI can be hiding central adiposity, which is indicative of diabetic risk. Thus, Filipinos and other Asians, including Japanese, Koreans, South Asians, and Chinese, also have more central fat than African Americans. Therefore, the American Diabetes Association decided to lower the BMI from 25 to 23, plus risk factors, to catch the Asian Americans who is normal appearing, normal weight, but metabolically obese. Remember, in the general population, people with a BMI of 25 or greater with risk factors is the group screened for diabetes. With the new American Diabetes Association guidelines, people with a BMI of 23 or greater are screened in order to catch the Asian Americans who may have a lower BMI but at a higher risk of diabetes. Furthermore, after the update, a study by Menk and colleagues in the Journal of the American Medical Association noted that 50.9% of Asian Americans living with type 2 diabetes remain undiagnosed. This study tells us that many Asian Americans do not know they have diabetes and supports the need to screen the Asian Americans for diabetes, especially if they have risk factors. It is important to act now if you or your family members have a BMI equal to or greater than 23, are older than 45, and have risk factors. Get tested or schedule your parents, aunts, uncles, and all your loved ones for a diabetes test today. If you would like to